Hi Mitchell, how you
Hello,
doing today?
hello, hello. Pretty good. How are you?
I'm doing good. So, what are we talking about today?
How to ace pharmacology. And this is pretty much all you, dude. 100% you.
Do you have pharmacology and nursing any or?
I actually did. But like you're actually going to school for this. I only had like one class. It was hard. It's annoying. Especially the math part, but like the memorization for specific weird names, that was just
I mean,
it
yeah,
was
when you
just
get when you get like 4 years of it and you work with it for 3 years, you kind of get used to the name. So it just comes
yeah.
along after a year or two working. We'll get into the tips now though. So, no brand, generic, and drug class. Did you have trouble with the brand generics?
I did. I did. Some of the names were just really hard to memorize. I memorized how to write them because my professor was just really strict and she wanted the exact names because you're gonna kill somebody. So we kind of had to like really know it. I did like it was like drilling it in. I didn't know how else to study it. I didn't know how honestly. I just read it and tried to memorize it the best I could. How did you do it?
So basically, just repetition over 4 years. I mean, I guess people in nursing don't really have that luxury of studying drugs for 4 years,
No,
but
like one class.
but basically, you need to separate in classes first. Because if you have it in classes, you can pretty much say, okay, lisinopril is a pril, and enalapril is a pril, so you know they're the same class. And I'd be like, okay, what's the brand of that? And it's basically like that because drug classes also have like the same side effects. I don't know if you knew that or not.
Yeah, yeah.
So just do about bring down drug classes first, then learn the names, and then you go from there.
You see, I didn't do that. I
And
didn't.
most people really
I
don't do it. They just go straight in and go, I need to memorize this and say it in their head a million times, and they forget it on the
Yep,
test.
yep. All right. So you did the class, and then you broke him down.
Yeah, I break everything down in the smallest steps I can.
Okay.
At first, I did try what you did. My first semester of pharmacy school, so starting even straight first semester of pharmacy school, they make you memorize 300 drugs. Well, 150 first semester and 150 next semester.
Do you still like by any chance? Do you still remember any percentage of those 300?
Oh, you have to. They're all in my boards coming up. So like
Oh, okay.
that you
So
every year you retest on it, but they're adding more stuff to the exam. So the first exam was just brand generic,
uh-huh.
and they add like a random dosage form in there. So it might be like Voltaren comes in. I think it's suppository. I could be wrong on that, but I think that's what it is, suppository. And that'd be a question somewhere on the test because that's different.
So and how many drugs have you learned so far?
Oh, over 300 because like disease states have crazy drugs like oncology and stuff. Yeah, don't get me started with those. I don't remember the
And,
names
and
of those.
and you have to know all of them for your boards.
Yeah, so it was like 300 you need to know brand generic
Oh my
for. Then
god.
and like very specific stuff about them. Then the other drugs is more about like specific disease states. So there's a second tip, which is disease states. So if you
Mm,
know how a disease works, you can kind of work backwards and know what the drug does. If that makes sense.
yeah.
So if you know how glaucoma works, you can be like, okay, there's might be something you know how it works. Or like, okay, maybe I can block that in the eye to make the liquid not swell up as much. That's basically what the eye drop dudes do. I don't know specifics on those anymore because it's been forever, but that's kind of how you have to work around it though. Because you need to know how the drug works. If a doctor walks up to me and be like, "Hey, what's that drug?" I'm like, "Okay, it's that drug, but this is how it works." So then he might be like, "Oh, that's not really what drug I wanted." Then it doesn't happen too often,
Mm,
but it does happen. So,
okay.
are you a big visual person?
I am, yes.
So, did you ever think about putting the drugs in a table?
I think some of my friends they had like study groups in the library, but like it doesn't really work with me study groups with those people
Yeah,
because they ended up not studying. But I think they did tables. I never tried tables.
I didn't even try tables till probably really my last semester of pharmacy school, which is sad. But
Did it work better than anything before?
I mean, I already knew the drug very well by then because pretty much not doing anything last semester of pharmacy school except like reviewing in our capstone course was like reviewing everything you learned in pharmacy school in one class. So I kind of knew the
Wow.
drugs pretty well already. But it was just nice seeing it all in like instead of like a 20-page document, it was a lot shorter because everything was like more condensed in the table format. Actually, it'd probably been more like a 60-page thing, but you know what I mean.
And all these exams, how many exams, pharmacology exams, did you have you taken?
I can't count because every exam's a pharmacology exam.
Oh, okay, okay. So is it not like, do you have like exam that is specific on just drug generic brand names, or just drug
Just
classes?
first semester, and then after that they added to it. So eventually, like second year of pharmacy
So
school, they
just
added
gross.
on like disease states with it because second year is when you learn your disease states. So we started off cardiology, pulmonology, nephrology. Second year of pharmacy school,
Ah, okay. All right.
and then you learn the drugs associated with that disease state, and then it sticks in your head better. Like, okay, then when you're working, you'll be like, oh, that's albuterol. Oh, that's that. That's Advair. Oh, that's how you work that. Here's the side effect you need to know about it.
So you've what's the lowest grade that you've received on one of these exams?
Like a drug exam specifically,
Yes.
like brand generic, adding stuff to it.
I don't know. You tell me.
Those exams, I think my lowest grade was like an 88 maybe.
Wow.
Now in
Okay.
a regular class exam, they make them hard, so like my average grade is probably like a B on them because they put like
Okay.
really minute details in that you won't really need to know later in life, but it just like makes a bell-shaped curve.
Okay.
And then side effects. So you need to know three main side effects: so the weird ones, the bad ones, and the common ones. So there's some drugs that'll turn your pee red, and some will turn it orange. There's some that will turn a baby gray blue.
I've heard about that. I've heard about that. Yes.
And like those are side effects that like you will be asked about because it's like easy points, one, and two, you have to tell the patient about it. If not, they're gonna be thinking they're dying
Oh
if their
yeah.
pee is red or orange, you know, like stuff like that. Or if a QT prolongation.
I forgot there's a drug that makes your pee turn green. I forgot what it was.
I don't think that was in my list.
Or maybe was it orange? I don't know. It was like my class was so long ago. So, but do you have to remember all the side effects? Is that like a mandatory thing?
It's mostly by disease state. So like some teachers
Okay.
would be like, okay, for example, albuterol speeds up the heart, and you need to know that. And that's just like a
And
common thing you know.
how did you manage to remember all these side effects? Was there like a
Uh,
mnemonic that you did, or?
no, there's not enough mnemonics for all those. Mostly just repetition because I'm learning the same drugs over 4 years, but like Anki helps, writing them out, keeping studying those flashcards you made for the exam, and keep doing them after the exam's over so you don't forget them.
Okay.
So like I still have cards in my Anki deck that were from like my second year of pharmacy school. Where it's like, oh, these are cards I made back then,
Wow.
and then I go back
Wow.
and like third another thing, I just go back and edit them and add stuff to them.
Do you feel like you're more prepared, or that you will be more prepared knowing so many drugs and so many diseases in medical school?
Yeah, mostly because like the stuff I see in pharmacy is mostly like calculation errors from doctors, especially in the
Oh,
pediatrics.
really?
Yeah, so if a
And like,
pediatric dose goes out wrong, it can kill
okay,
the patient, and then the pharmacist
yeah,
loses their license.
right. So you
And
have to
like,
double check.
yeah, because 1 0 is like kill the patient, where in an adult it's like, we'll be fine. So like an example is we had one dose. I didn't have it. CVS in a different county had it, and the error was so bad we got in our county heard about it. But basically, it was about 10 times the normal dose was dispensed to a kid,
Wow.
and it passed the ER physician, it passed the pharmacist in the hospital, it passed the CVS techs, and it passed the CVS intern and the pharmacist, and it still went out.
Is the kid okay?
I don't know. That's a mystery, but I hope so, or it'd be in the news right now.
Oh my goodness gracious.
But that was a couple of months back, but yeah.
So the pharmacist. So who will lose his job here? Who's?
I mean, everyone's pretty much liable. The physician should have known it. The pharmacist in the hospital should have known it. The tech should have known it, because that was like a couple bottles of like antibiotic they have to pour into a like big giant thing.
Okay, so I don't know much about this, but like whenever the physician sends in an order, I've never shadowed a pharmacist. So the pharmacist have to check every single dosage.
I mean, like for something like that, you automatically know. Like if you look at that dosage, you'd be like, I need to grab 3 or 4 bottles of amoxicillin to fill this thing for a 6-month-old kid. No. You, like you
Yeah.
know, like off the bat, like that's bad. But yeah, for kids, the pharmacist should calculate every single dose because physicians always mess up. So
Really?
yeah, so that's what goes into just dosing errors. That's like the math thing where you don't like it, but simple math and something physicians need to do. And just a recap before we go quit this episode. Weird side effects, so orange pea, red pea, something that sounds weird, you'll probably remember, so you don't have to worry about those. Bad side effects, so heart attacks, if a drug can cause heart attacks, it can cause QT prolongation, torsades, some drugs can cause torsades. That's pretty much instant death unless it's caught. And then common side effects, so it can cause a cough. Like Cinepro causes the cough. It's common, but it's also unique to its like hypertensive meds class, so yeah. Know the side effects based on drug class as well. Know like the common side effects in the class. That's all I got.
All right.
And we'll see you guys in the next video. Peace.